I'm Kelly Worthman in the CBSN Denver studio. As the COVID-19 pandemic continues, so does its impact on mental health. The pandemic has claimed tens of thousands of lives, and not just from the virus. Joining us now is Dr. Nati Geva, a psychologist with the Health One Behavioral Health and Wellness Center. Doctor, we really appreciate you taking time to talk with us. COVID-19 is taking a mental toll on a lot of us, but I understand at least one study is showing as many as 1/3 of COVID survivors have PTSD. Is that right?
That is absolutely correct. And some of the risk factors are being female, having a prior mental health diagnosis, having experienced delirium during the acute phase of the illness, as well as protracted physical symptoms after one is no longer ill.
What kind of PTSD are you recognizing or is being seen in these cases? Are folks afraid of getting the virus again, afraid of being near people? Can you speak to that a little more?
Well, the diagnosis of PTSD doesn't really address what people are afraid of, but essentially what you're saying does fit all of those things. There's fear of exposure, fear of having it, not knowing really if you can have it again or if you build immunity. And what we're seeing is just a lot of both avoidance as well as hypervigilance behaviors and just general changes in mood, peaks and valleys, inconsistencies, people really struggling to normalize and being easily triggered by things that remind them of the particular thing that traumatized them while they were sick.
I mean, it's very understandable. Of course, pre-pandemic life wasn't immune to mental health struggles, but they've skyrocketed since COVID-19 hit. Many Coloradans struggling with depression, anxiety. What are you noticing among patients?
Well, what I'm noticing is really that skyrocketing in mental health concerns in general. And so we're looking at a lot of depression and anxiety symptoms. So when symptoms become very significant, they're very regular, they don't go away, they even get worse, then we know we have a problem. In addition to that depression and anxiety, we do see the PTSD. We also saw a real significant increase in substance use and a lot of suicidal ideation.
Yeah, we were just talking about this actually with some of my producers, because thousands of Coloradans have lost their jobs, as I know you're aware of. They're struggling to make ends meet. Mental Health America says more people are reporting thoughts of self-harm because of the pandemic. So how can we put this unsettling course into reverse?
Well, right now we are in the middle of the crisis and we don't really know how long it's going to be. And even though we'd like to find a silver lining or find something, really it's too premature. Right now, our primary concern is to keep our head above water. And part of what we do to do that is to take good care of our physical selves. So that is good sleep, that is good nutrition, that is getting exercise, reducing substance use, alcohol, even prescription drugs other than those that our doctors give us. Taking care of that side. And then there's also other things we can do, such as keeping a routine, finding a routine that works for you and your family and sticking to it, because having a routine really helps us stay grounded in the present and not get lost either in ruminations of the past or fears about the future. And the last thing that I would like to recommend is really try and find joy in your day. Try and find pleasure and amplify that pleasure. Try to have fun, whatever that fun that is also longer term healthy is for you. So if it's playing with your kids, working in the garden, going to services, watching a game on TV, whatever that is for you, make sure to include that so that you also have things to look forward to and have hope.
I find a lot of that hope and joy with my four-legged friends. I think a lot of folks are really turning to their pets for comfort right now. But there's going to come a time when this pandemic is over, doctor, but that doesn't mean our mental and emotional impacts are going to end right away. So what advice do you have better to take care of ourselves now, like you just mentioned, but also when that time comes, when the pandemic is a part of our past?
And I'm so glad you bring it up, because what we talk about is building resilience. And it's never too early to start working on our resilience. And resilience is that either bouncing back from adversity or even growing from it if possible, or not being affected by it because we've grown it so much. And what's important is doing those things that we just described, the taking care of our physical aspect, but also making sure that we're surrounded with people who are positive, people who support us, healthy relationships. It's about knowing when to say no and remembering that when you say no to one thing, you're saying yes to yourself and yes to many other things. It's also about developing the ability to embrace the good, as we said, but also dial down the negative. What do we do when things are painful, when things are uncomfortable? Who do we turn to? So all these things as an encompassing strategy of how to build our resilience, which is going to help us today and will definitely carry over when things calm down as far as COVID goes.
I think that that's the best advice, is finding good in every day as much as we possibly can. Dr. Geva, thank you again so much for your time and for your insight. Now, if you or someone you know is in need of mental health support, do not hesitate to reach out for help. We have a link to local and national resources at cbsdenver.com.